Are you taking daily medication for allergies, insomnia, anxiety, depression, or even bladder issues? What if the very pills you rely on for comfort are silently, relentlessly, and permanently damaging your brain? Imagine discovering that a common medication, tucked away in your medicine cabinet right now, could be quietly escalating your risk of dementia. Startling new research reveals that taking just one of these widely available drugs daily for as little as 12 months could skyrocket your risk of dementia by a shocking 50%. This isn't about some obscure or experimental compounds. These are everyday pills, and robust studies from multiple large-scale investigations are providing compelling evidence that they are directly linked to alarming brain shrinkage and irreversible memory loss. The urgent truth is, countless individuals are unknowingly accelerating the onset of dementia day by day without a clue. It's time to uncover what these hidden dangers are, how they are silently eroding your cognitive health, and most importantly, what safer alternatives exist for you and your loved ones. The medications we're talking about belong to a class known as anticholinergics. While that might sound like a complex medical term, it simply means they block a crucial brain chemical called acetylcholine. Think of acetylcholine as your brain's vital spark plug, the essential neurotransmitter that enables neurons, your brain cells, to communicate effectively with each other. This vital chemical is indispensable for fundamental brain functions. It helps you remember important details, focus your attention, and even coordinate your muscle movements. When you take these anticholinergic drugs for extended periods, it's akin to throwing a major wrench into your brain's delicate communication system. The once strong neural signals begin to weaken, progressively degrading over time, a process that tragically culminates in memory loss and eventually dementia. What makes this issue particularly concerning is just how prevalent these anticholinergic drugs are. Many common medications you might not suspect fall into this category. For instance, classic allergy relief drugs like Benadryl are anticholinergic. They're also found in numerous over-the-counter sleep aids such as Tylenol PM or Unisom. Certain anxiety medications like hydroxyzine, often known by brand names like Vistaril or Atarax, also belong to this class. If you're using medication for bladder control, such as Ditropan or Detrol, you're likely taking an anticholinergic. Even some common IBS treatments, like Bentel or motion sickness patches like scopolamine, are part of this group. Whether they're prescription medications or readily available over the counter, they all share the same concerning brain blocking effect. The scientific evidence supporting these links is extensive and deeply worrying. A comprehensive systematic review and meta-analysis, which pooled data from over 1.5 million people, unequivocally demonstrated that anticholinergic drug use is an independent risk factor for both all-cause dementia and Alzheimer's disease. This study further highlighted a dose-response relationship. Heavier or more prolonged exposure to these drugs was consistently associated with a significantly higher risk of developing dementia. Another equally alarming meta-analysis, which synthesized findings from 21 different studies, revealed that using anticholinergic medications for more than just 3 months increased the average risk of dementia by an estimated 46% compared to non-use. That's a nearly 50% increased risk from a mere quarter year of taking these medications. And it's not just about perceived brain fog. A study published in JAMA Neurology, which utilized advanced brain imaging and metabolism analysis, demonstrated that the use of anticholinergic medications was directly associated with increased brain atrophy, meaning your brain actually shrinks, and measurable brain dysfunction. These drugs aren't merely making you feel groggy. They are literally altering the physical structure and metabolic activity of your brain. To understand why these medications can be so harmful, especially with long-term use, it's crucial to grasp what's happening at a cellular level. In your brain, acetylcholine typically binds to specific receptors on neurons, particularly the muscarinic receptors. This binding is essential for facilitating clear, efficient communication between brain cells. These muscarinic receptors are not only found in the brain, but are also crucial components of your parasympathetic nervous system, distributed throughout your body in organs like your heart, lungs, and digestive system. This widespread presence is why these drugs are effective at reducing symptoms like nausea, gut spasms, or an overactive bladder. However, in the brain, when these drugs block communication in critical areas like the hippocampus and the cerebral cortex, regions absolutely essential for memory, learning, and overall cognition, the consequences are severe. While short-term use might manifest as temporary brain fog, confusion, or slowed reaction times, consistent long-term exposure can lead to permanent neurological damage and measurable brain shrinkage. This effect is particularly pronounced and concerning in the elderly, as our natural acetylcholine levels naturally begin to decline with age. If you're taking a medication that further suppresses this already diminishing activity, you are, in essence, rapidly accelerating a natural decline, effectively cutting off one of the brain's main lines of communication, with accumulating damage the longer this continues. So, how do you navigate this challenging information? It's important to clarify that we are not suggesting these drugs should never be used. Taking a single Benadryl for a night or two when sleep is elusive, while not ideal, is generally considered acceptable. Similarly, in emergencies or for severe allergic reactions, Benadryl might be necessary. And for conditions like urinary incontinence or irritable bowel syndrome, these drugs can sometimes be vital. The critical message here is to avoid taking these medications every day for months or years. This caution is especially important for individuals at higher risk, which includes anyone over 60, those who already experience some memory issues, or critically, people who are taking more than one of these anticholinergic drugs simultaneously. It's surprisingly common in medical practice to see a patient taking hydroxyzine for anxiety, followed by Benadryl or Unisom for sleep, and perhaps Ditropan for bladder control. While each drug individually might block a small amount of acetylcholine, their combined effect can be profoundly detrimental, effectively shutting down major parts of the brain and central nervous system. The first crucial step is to take inventory of your medicine cabinet. Go through both your prescription and over-the-counter medications. For each pill, either search online or consult your doctor or pharmacist to determine if it has anticholinergic properties. It is absolutely vital that you do not stop any of your current medications or make any changes to your regimen without first discussing it thoroughly with your doctor. Once you've identified any concerning medications, engage in a conversation with your healthcare provider to explore safer alternatives, especially if these are drugs you need to take long-term. For example, if you're using an anticholinergic for sleep, non-anticholinergic alternatives might include natural options like melatonin, ashwagandha, chamomile, or specific forms of magnesium. For prescription sleep aids, trazodone is often recommended as it has minimal to no anticholinergic effects and can be highly effective. For allergy sufferers, transitioning to second-generation antihistamines like Zyrtec, Claritin, or Allegra is a much safer bet compared to first-generation drugs like Benadryl. While these second-generation options are technically still anticholinergic, they have significantly less penetration into the central nervous system and the brain, dramatically reducing their likelihood of causing brain-related side effects. If you're on bladder control medications like oxybutynin, Ditropan, tolterodine, Ditrol, or solifenacin, Vesicare, ask your doctor about non-anticholinergic options such as mirabegron, Mirabetrix, and for those dealing with IBS and prescribed drugs like Bentyl, discussing alternatives like peppermint oil or other prescription medications that don't carry the same brain risks. Tailored to whether your IBS is constipation or diarrhea predominant, would be beneficial. If you've been on these drugs for an extended period, there's no need to panic, but this information should serve as a powerful catalyst for action. You can start optimizing your brain health immediately by prioritizing regular, quality sleep and consistent physical exercise. Equally important is focusing on reversing other well-known risk factors for cognitive decline and dementia, such as managing insulin resistance, high blood pressure, and existing heart disease. This is just the beginning of a broader conversation about protecting your most vital organ, and we'll be diving deeper into comprehensive brain health strategies in future discussions. Stay informed, stay healthy, and take proactive steps to safeguard your cognitive future.